Hello everyone! During this video, I would like to discuss to you an example of oxygen therapy which we are going to use to the patients who has impaired gas exchange. There are conditions that we are going to use an oxygen therapy. First is COPD or chronic obstructive pulmonary disease, pulmonary fibrosis, pneumonia, severe asthma, cystic fibrosis, and the last one is sleep apnea. There are 5 types or routes in delivering oxygen to the patient. First one is the nasal cannula, the simple mask, non-rebreather or rebreather mask, and the last one is the Venturi mask. So for this video, I will be discussing to you and performing how to use first nasal cannula. The nasal cannula is a low-flow system that mixes oxygen with room air. The flow rates range from 1 to 6 liters per minute, providing 24 to 44% of inspired oxygen. Rates above 4 liters can dry mucous membranes and cause discomfort and bleeding, so add humidification. Prepare a wrench, medical regulator set, distilled water, and a cannula. Attach oxygen flow regulator to oxygen tank. Rotate locking nut in clockwise motion. Tighten the locking nut using the wrench. Attach humidifying bottle with nut into the oxygen tank. Remove humidifying cap and add half full of distilled water. Gently attach back the cap to the humidifier. Close the flow regulating valve first. Gently twist the wheel-type valve in counterclockwise motion. The pressure gauge will move depending on how much the content the oxygen. Open the flow regulating valve. Flow meter will move. The ball will be the indicator. The normal flow meter is equivalent to 2 liters per minute. Attach cannula tube in oxygen outlet. Lastly, don't forget to check the patency of the cannula tube. Let's start! Introduce yourself upon entering the patient's room. Post no smoking sign to the patient's wall. Check vital signs to monitor the patient's status before receiving oxygen therapy. Check for any abnormal lung sounds with the stethoscope and refer to the physician. We'll be using an adult nasal oxygen cannula. Use micropore tape to secure nasal tube. Start with the procedure, you need to disinfect first your hand to prevent from cross-contamination. Nasal cannula has 2 prongs, a tab, and a sling. Slowly attach the 2 nasal prongs to the patient's nose. Anchor the 2 nasal tube behind the patient's ear. Secure the nasal cannula by sliding up to the patient's chin. Attach the end of the cannula tube to the oxygen outlet. Open the flow regulating valve and regulate according to the doctor's order. Write down the time started with the. Watch out for symptoms of oxygen toxicity, including coughing, chest pain, or blurred vision. Aseptically remove the nasal cannula to the patient and discard according to hospital. Always check patient's vital signs after the procedure. Always do proper hand washing before and after the procedure to prevent nosocomial infection. Document all necessary information to the patient's chart and refer to the physician. That is all for today's video. Thank you for watching.